And now to introduce Tina. She and I are going to talk about everything you need to know about the toolbox across multiple levels of interventions for infodemic management. Over to you, Tina.
Thanks, Liz. So we have 20 minutes. Let's do it in tandem. We do have quite a lot of slides, but you will receive all of these also on LMS, and feel free to also contact us with any questions. So Liz and I prepared some practical recommendations and an overview of interventions that you can apply for managing the infodemic. To really also and also the infodemic risk in communities. So by the end of this lecture, you will have a basic understanding of the practical interventions that you can undertake to address. And of course, also we will draw parallels to how you can adapt the models that you've seen in the previous sessions of the training, like the journey to immunization or rapid community assessments. How you can actually use those models to examine the infodemic related challenges in the community of focus that you're focusing on. What would practicing the infodemic management look like in a health authority if all of the processes were in place to enable full infodemic management? One would look at all these 5 steps. You saw this figure before in the social listening lecture, where
I think I'm still seeing the title slide, or is that just me?
Oh, really? Sorry. Can you see it now?
Yes.
Oh, I'm really sorry. The laptop wasn't updating. So you saw this figure before. You've seen this figure before. The social listening is really, and integrated analysis are really the first step that gather the evidence and the insights in order to be able to then essentially deliver high quality health information and programming, but then also inform interventions and promotion of resilience to infodemic, promotion of healthy behaviors, and also community engagement. And then, of course, we always need to think about how we then strengthen preparedness, planning, policy, and systems through the lessons learned and things that we've learned during our work and practice. This is a very busy slide, but suffice it to say, when we think about intervening on the infodemic, just like, for example, with public health and social measures, we really need to think about how to intervene at different levels, because the infodemic is really complicated. The phenomenon is very complex because the information environment really permeates our interactions, both within the information ecosystem, there are certain behaviors, information seeking behaviors, and how information affects us as individuals. And then, of course, all of that affects also the ability of the health system to not only communicate with the communities, but actually health system may be affected even with delayed and missed care costs and overburdened healthcare services due to people changing their behavior, health behaviors due to the infodemic. So what are some practical infodemic management actions that you could take to support a health program or preparedness and prevention in health emergencies? So keep in mind that infodemic managers, we basically have tools at our disposal to be able to partner up and support any health program. In this case, we will be focusing on the immunization program, but also we could be just as much working with colleagues and in preparedness and prevention of other health emergencies. So what would you need to do the first when you really, as an infodemic manager, you come into a country, really do an infodemic landscape analysis really quickly, do a SWOT analysis, really looking at to understand the program, the current staffing, the resources, the data available, and also look at the gaps that potentially that have been identified, so that what are the actual questions and problems that the program manager that you're working with, what are they trying to solve, that the Infodemic may be contributing to. And Liz is going to show you some of the things more practically later on. So when one thinks, well, what can you practically do? You actually can take actions or recommend actions at several levels. So at the national level, first of all, you've heard this before in the social listening lecture, identify the information voids. Because if you proactively identify where is the confusion, where people are lacking information, they're seeking it, but they're not finding it. This is the essential best buy intervention that you can do to invest in answering those questions and providing that type of information. So really, the way that you can even understand the audience needs better is through user journeys, and you've seen that discussed as examples in the human-centered design lecture. Second, what you can also do is improve the quality and the quantity of health information available. So it's really important that you really look at all of the different channels that the health authority is using, how updated and at what quality and clarity is the health information being provided for different audiences, etc. Really prepare the health system to be able to respond to most common questions. And of course, one of the strategic things that you could do is you can govern all of that through really setting an editorial or content strategy and in anticipation of the questions, concerns, and certain and expected infodemic risks. Thirdly, what you could also do is really focus on tailoring the content and different approaches to most vulnerable populations. So here in the infodemic management, in social listening and infodemic management and insights generation, segmentation of the insights for different identified vulnerable groups is really key. So as much as you can inform your actions with understanding of the needs, information needs for different vulnerable groups, who very often will have a different information need that you will need to fill. What you also will need to look at is be effective, proactive, thinking about how you will link your online efforts to offline behaviors. Right from the get-go, define the indicators that assess individual factors that are reasonably likely to be impacted by the infodemic strategies. So knowledge, awareness, perception, but also are the usual that we think about, but also, for example, people's ability to discern accurate from inaccurate health information, or knowing where to find credible health information, or even thinking about a trust in health information. So be careful that you're not trying to change the overarching case numbers for a particular outbreak. What you can link your actions to is people's more concrete health behaviors regarding knowledge, awareness, perceptions, etc. Connect also to networks for implementing infodemic management strategies. As an infodemic manager, you really need to think outside of the box in what partnerships you need to build, even beyond the usual networks. And really, not only for collecting information, but also sharing that information back. At the health facility level, you can take 3 actions. One is really making this high quality health information content more widely available in more formats. So really look at how you will effectively use different spaces in the health facility in order to disseminate the information most widely in many different formats. And not only to patients, but also to healthcare workers. So visual job aids, etc., can be really helpful there as well. You've heard a whole lecture earlier on encouraging quality patient conversations. But keep in mind that from the infodemic management perspective, these conversations can also be asynchronous, which means in the digital space, they do not need to be taking place synchronously. So at the same time, we're in a conversation between a healthcare provider and a patient. So this is the opportunity for you to really think creatively about how to use digital spaces and digital communities. You have here, for example, one of the tips, share a WhatsApp tip or helpline. And that's an example of asynchronous digital sharing of information. And also, of course, train health workers on addressing patient questions, concerns, and misinformation. You heard about motivational interviewing because that's one of the really proven evidence-based methods to elicit effective vaccine conversations. Now, at community level, you can coordinate how trusted messengers and institutions share health information. And you can really be proactive in equipping them with fresh content, not just with messages, but content. So this is where your added value as an infodemic manager comes in. You can provide social listening and infodemic insights early. And not just the insight, but also the recommendation strategies and content, so that the trusted messengers can then address emerging narratives or misinformation much more quickly. The second thing that you could do at the community level is to identify health experts and professionals who can speak to community groups online and offline. You heard this several times during the trainings that healthcare workers are the most highly trusted source of health information for people universally across the world. And these are definitely trusted messengers to invest in and to build partnerships with. So as an infodemic managers, beyond the usual strategies that you may be familiar with, think about also identifying digital native health workers. So health workers who have grown up with the social media, with the digital environment, who are using the online media as part of their everyday life. They're very comfortable with it. They know how to interact with it. And they are the best resource to be trusted messengers, not just to their patients offline, but actually also as a healthcare provider online. And lastly, the third intervention that you could do at community level is to create a rapid response plan with the health system and immunization stakeholders on what to do and how to communicate in a crisis. Be prepared. There's really different types of infodemic risks that you can prepare for and what you would do in each particular situation. So Lisa, I would hand it over to you. So how do we operationalize infodemic management related data collections and synthesis and then response of using the existing tools that we have actually talked about during the training? Over to you.
Right. So these are going to sound familiar to you, but we're essentially going to add an infodemic lens on top of some of the existing tools you've already been introduced to. Next slide. So remember the journey to immunization? Well, here's the infodemic version. So there are domains in the journey to immunization that can be impacted by the infodemic in every step of the journey. Wherever information is received, sought, exchanged, can be places along the journey where the infodemic may impact perceptions and behavior. And so therefore, we can also query all aspects of the journey to understand how the infodemic might be impacting people on every step. So how do people talk about vaccines? Compare how do they signal about vaccines online and offline, before and after vaccination? What kind of vaccine related information seems to feel overwhelming to people? What kind of information are they seeking and not getting enough of? What role does the media play in amplifying or channeling vaccine concerns or misinformation? What can be done to address this? How are health workers affected by the infodemic, and how does it affect their relationship to their patients? And where is their silence? Which perspectives or reflections on each step of the journey are you missing? So if there's silence and you don't know enough about what's happening at one step, maybe the social listening approaches that you're using are not capturing those perspectives. You might need to consider finding other data sources to reference. Next slide. So let's talk about HCD tip. So do you remember the BES model? So that's that blue box in the top right, about where you have these buckets of thinking and feeling, social processes, motivation, and practical issues that impact vaccine uptake. So here are some questions you can think about for each of those buckets. So for thinking and feeling, what kind of exposure to the infodemic does this person have? What are they seeing that might worry them? How might they react to too much information, concerns, or misinformation online or offline? And then if you go to the next slide, for social processes, what are the relationships networks that this person is part of, especially online? What kind of attitudes or norms are perpetuated online that this person is exposed to? What sources of information do they trust? What online spaces do they trust? How does this person interact with health voices online? When you're thinking about motivation, what are this person's needs and wants, and how are they expressed online? And what would they be exposed to online that would motivate or demotivate them from seeking vaccines? And so these are some of the things you can think about. And for practical issues, this is actually, I think, underutilized when it comes to social listening. So thinking about what complaints or feedback does this person have about health service delivery, especially online. So think about like ratings and reviews websites, for example, that people are leaving into health service social media or geolocation pages. What frustrations does this person voice about access barriers to services, and what tech or digital barriers may affect this person's ability to get health information or to get vaccinated? So these are some of the common questions you can ask. And these are actually built on top of the section for the HCD tip tool that's around building a persona. And now we'll switch gears again and we'll talk about the rapid community assessment. Now, the RCA can also include infodemic components. In fact, we actually made a specific version just focused on social listening and young people in digital contexts. What we did is we actually did a rapid community assessment in San Mateo County, California, where it wasn't just CDC investigators investigating. We had 16 teenagers co-investigating with us because we wanted to understand what are the questions, concerns, and circulating narratives and misinformation that teenagers are seeing online as we were getting ready for adolescent vaccine introduction for COVID-19 vaccines. And the reason why we wanted to talk to teenagers about this is because the world their parents inhabit online is very, very different than from their teenagers. And so unless we actually talk to teenagers about that world that they live in, we're never going to fully understand that online world. And so we actually have a special addendum that's specific to adolescents and digital spaces that you can reference, and that there are additional analytic and data collection methods that you can use, such as online observations, that are helpful because public health practitioners might not have direct access to these online spaces. So how might you work with key informants such as teenagers talking about their own online experiences if you yourself don't have access to those spaces? Next slide. We have tons of resources that are linked here. I highly recommend these readings and videos, and particularly if you subscribe to just one newsletter out of your entire time in this particular training, you should subscribe to the Infodemic Management Newsflash. It's excellent, and it really gives you an up-to-date list of the latest and greatest infodemic news, resources, peer-reviewed journal articles, publications, opportunities for fellowships and jobs, anything you can think of, it's there. And Sergio did a really great job actually talking about how the African Infodemic Response Alliance has also been responding to the infodemic using some of these similar approaches. So we're hoping this is a little bit inspirational, and there's even more. There's like over 99 slides to this entire slide deck. So we just gave you like the tip of the iceberg here. There's a lot more. And if you have any questions, feel free to ask myself or Tina